Well, it's time for us to talk health, and to do justice to that is Dr. Dorothy Jeff. She is the MD CEO of Novel Health Africa Limited, which of course is committed to creating value through excellent coordination and efficient delivery of healthcare services, better client experience during hospital visits, which is key as always, enhance client engagement in their own healthcare, reduction in medical errors, and of course, improved clinical outcomes. It's such a pleasure to have you in the studio with us today, Dr. Dorothy. How are you doing?
Thank you. I'm good.
Okay. I'm doing very well. Health is something that I've always had great interest in, especially with, clients, or rather patient-doctor relationship, or patient-medical officer relationship. I use medical officer because you're going to meet a lot of people,
Exactly.
pharmacists, nurses,
all the health
laboratory guys,
yes.
and also, yes, the health personnel in general. It's very important to have a great relationship with them. However, today our focus is more on that. Yes, relationship. However, information and the importance of the information you provide when you go to the hospital. Please tell us more about that.
Okay, thank you for having me.
Our pleasure.
First, I would like to start by saying that every information is vital.
Yeah.
When you're in the doctor's office, there's nothing that is outside the box.
True.
So it's important that you cultivate that relationship, or you already tell yourself, once I get in there, I'm going to be as open as possible.
Yeah.
So every question, there's no stupid question.
Yeah.
Every question is vital.
And there's no embarrassing
There's
question.
no embarrassing
Yes,
question.
because
So
that's why you
must not lie.
Yeah.
And then secondly, the health personnel, like you said, are ethically bound to inform you on all the facts necessary for you, to know how to progress on the outcome, why decisions are being made, and if possible, what may happen after that, once you leave that particular office. So you have to understand what has occurred and may or may not happen much later, because you might need to be making adjustments, in your lifestyle or any of that, and you need to know. And again, so with that, I always tell people, when you visit a doctor, or after, let me also use your word, not just about the doctor, but when you've had a healthcare service, you must be able, in your own words, to actually explain what has happened, or what was wrong with you, and how you're supposed to take care of yourself going forward. If you cannot interpret in your own words, then you haven't had a visit.
There's a lot of truth in what you just said, because I've actually, when a doctor is clicking a child, there's this, okay, as a child, you cannot really tell what is wrong with you.
Exactly.
So your parents or guardian has to be the one to try to explain what they feel is wrong with you.
Yes.
But then you also have adults struggling to express themselves. And so the doctor is saying, for example, you come in, you say, oh, your tummy, is hurting. And the doctor is like, where? Is it under your belly? Is it on top of your belly? Is it on the side of your belly? And you cannot even describe it. And people don't realize that information, as tiny as it may seem, is very vital.
Very important. It's very important. And you know why that happens? Because people they don't see themselves as a healthcare consumer.
Yeah.
You don't see yourself as a consumer. Just like in every other consumer-centered system, in every sector, you are a consumer. You're coming to get something from the health system.
Yeah.
So you also need to prepare. People don't prepare to go to hospital.
True.
They just, go in there, whatever they do, they finish and drop it there.
I think the worst is, I don't know.
And sometimes come with that, it's charity, beggarly attitude, just help me, that kind of thing. So it's important they also understand that your visit does not start and stop in that doctor's office.
Yes.
You have to, it comes from when you have already made up your mind and said, oh, I'm going to see this. So whether it's starting from even the kind of plan you purchase in your HMO, you be very honest. Sometimes you tell people to fill form, they hide all the underlying or chronic illnesses.
Yes.
That is already a wrong start.
Yeah.
So you must know that in you participating, in you being honest, you're also being part of the decision-making process in your own health,
yes,
which is really important for you to get a better outcome. Yeah. And the doctor wants to help you in terms of safety. What is he doing for you? Have you told him you have that allergy? So that in trying to help you, he does not harm you.
Yes.
You know, what about the, efficiency of the whole treatment? You have to interact. A doctor wants to send you for this. No, I don't have money for this. Can I go for that? Are there other options?
Alternatives.
Exactly.
And people don't know.
That the healthcare was affordable does not mean that it is below quality.
Yes.
So affordability is very important. Effectiveness.
Yes.
What are your values? What do you want the doctor to integrate in the course of, treating you with his clinical expertise and all the evidence, of research and everything? What's your value as a person, integrated in it? You have to make that conversation. What about time? Timeliness. When you're going for the appointment, is it okay for you? Or would you rather come? Is there something that may even stop you from coming to the hospital? Exactly. So all of that, and not only going to the hospital, like I said, it doesn't just start in that office. It starts from when you have now said, I'm ready to take care of my health.
Yeah.
I'm going to purchase a HMO plan. I don't want to pay out of pocket. These are the things I want to do. In that timeliness, everybody is listening to you, all the healthcare personnel, because they are responsible for you. And which is why just last month, in Novo Health, we launched what we call the Novo Apoyo. And what it does is that, and it has changed, disrupted how people actually go for their hospital visit. You come in there, so people are not scared and say, I'm going to waste all the time in the hospital. I am not going. So you come, all you have to do is a digital process, which is different. So instead of the hospital trying to find you out, you are coming there self-checking. Like I said, you're a healthcare consumer.
Yeah.
Just like you're traveling in the airport, you can check, how it, before we never used to check ourselves in. Now you check yourself in.
Yeah.
So in healthcare now you can check yourself into the hospital at your convenience.
Yes.
So you come in there and the doctor is able to, they're not checking your blood pressure because you have waited, you're angry, your blood pressure is high.
Yeah.
So all these things can be disrupted. And then you talk about patient-centeredness. The doctors, when you now get to the hospital, what happens? They have to inculcate, your needs, your values. They have what are your you have to express what your preferences are. What are my preferences in this course of treatment?
And then it's also important to be open-minded to tests.
Exactly.
People are so wary of tests. They think of the cost. They think, can't you just diagnose by the things I've told you?
Now, which is why your communication is very, very key. Because there's just a lot, because
really,
that's where you also look at equity.
Just
as a person.
Said, there is a lot.
There's a lot.
There is
be
a lot.
open.
But really,
you have to be
say
open.
Thank you very much. This has been very enlightening, and I'm pretty sure a lot of people learned from it as well. Thank you so much for your time, Dr. Dorothy.
Thank you.
We'll take this quick break. You're watching Wake Up Nigeria. We'll be back in a bit. To stay with us.